Hi guys, it's Dr. Denny over at Four Paws at Fulshire Veterinary Clinic, and Maddie and I are going to be chatting about cat heart disease. So hopefully this helps answer some questions that you might have, and if it doesn't, please feel free to reach out to our office.
Dr. Denny, what are some heart problems cats can encounter?
So we can get arrhythmias, we can get heart murmurs, we can get enlarged heart muscles. So basically, the same things that can happen to dogs can almost all of them can happen to cats. So we can have murmurs where one of the valves is affected. We could be born with a congenital heart defect. We can have a progressive genetic condition like hypertrophic cardiomyopathy. For my people that own Sphinxes or Maine Coons or ragdoll cats, those are going to be a little more prone to that disease where the heart muscle gets really thickened, and so the chambers of the heart get smaller and smaller. But these are examples of heart conditions that cats can get.
How do heart issues impact the health and well being of a cat?
So it's going to affect their lives just like it would if you had heart disease. Okay. They may be a little more tired. They're a higher risk for a heart attack or some kind of vascular event. They may be prone to certain side effects of having heart disease, like getting out of breath faster, having exercise intolerance. So there are definitely some more risk factors that will be associated with them and affect their lifespan.
What preventive measures do veterinarians recommend to help avoid feline heart issues?
So, feeding a balanced diet is going to be important. There's also knowing what kind of cat breed you have. If you have a purebred Sphinx or a purebred Maine Coon or a Ragdoll, getting them tested to see if they're carriers for that genetic marker of the HCM or the hypertrophic cardiomyopathy is going to be important. Making sure that they are coming into the veterinary clinic once a year for their physical exams. And it's so hard. I know that it's so hard. Nobody wants to take their cats in because of how stressful it is on both the owner and listening to your cat cry the whole drive up here. And if you'll go and listen to my kitten socialization video, we can also socialize our cats to their carriers. Because if you think about it, the stress of the visit actually starts at home. It starts at getting your cat in the carrier. I mean, how many times have you gone and tried, you get the carrier out and then all poof, your cat's gone. We really need to do a better job of seeing our cats every year to track these diseases. But basically, we're listening for murmurs, we're listening for arrhythmias.
What are some signs and symptoms of cat heart issues and what problems can they cause?
So, coughing, labored breathing, if their tongues are, instead of nice and pink, if they're turning a little bit purple, rapid breathing indicating that they're having trouble oxygenating, coughing, fainting, so they can pass out just like humans and dogs can. And unfortunately, one of the most severe cases we can see is if they throw a blood clot and it travels down their aorta and lodges in the femoral artery uh, or in the vein, and the cat loses all function and blood flow to the hind limbs. That's called a saddle thrombus, but that's probably one of the most severe conditions that we can see. So those are kind of just to name a few.
Why is it important to avoid self diagnosing heart problems in your cat?
Because you're not a veterinarian, so you're not going to know the ins and outs of the diseases. You're not going to know what side effects to look for. If you are a MD or a nurse practitioner or someone in the human side listening to this, we know that cats are not small humans. We know they get different diseases. Now, some of the principles may be the same, okay, but like we're trained to pick up on more things than you are, especially if you're just a layperson that's in engineering. You're not going to understand how to treat heart disease and the signs and symptoms. And that's why it's so important that you get your cat in once a year, because we have a chance to catch these and sometimes intervene early before, things could go south.
How will a veterinarian diagnose heart issues in my cat?
So, generally, a physical exam is going to be where we start. So, just like your doctor listens to your heart in different places, so do we. So, I'm listening for the two beats, the lub dub, the lub dub. I'm listening to see if there's an arrhythmia. I'm listening to see is there a murmur. And in some cats, like my high risk kitty cats, like my Maine Coons or my Sphinxes or my Ragdolls, I'm actually going to recommend chest x rays and sending out cardiac enzymes called a pro-BNP before we even talk about anesthesia, because these cats are prone, and HCM or hypertrophic cardiomyopathy is called the silent heart disease of cats because sometimes you don't hear it. You can't hear it. And on an x-ray, sometimes you can catch it on an x-ray or a cardiac echo, which is when we use an ultrasound to go and actually look and measure the chambers of the heart. But hypertrophic cardiomyopathy is where the heart muscle gets really thickened, and instead of getting thickened outward, it goes inward. So a chamber that, is this big goes down to like this big. So it shrinks the chamber size. So these cats have nowhere to pump their blood. So, sudden death in those cases is absolutely a risk.
What is a veterinary cardiology workup?
So, in general, blood pressure, chest x rays with a radiology readout, and then a cardiac echo, and sending off a blood test called a pro-BNP. That's usually where I'm going to start. I also like to have a baseline lab panel because your heart is a big organ and it's responsible for pumping nutrients, oxygen, taking away CO2 for all of your organs in your body. So getting a good baseline and making sure that organs are healthy, liver, kidneys, pancreas, etc., having a good baseline of labs is going to be important as well.
What are some possible treatments or procedures for a cat with heart issues?
So, chest x rays, the cardiac echo, I'm sending off cardiac enzymes is going to be kind of where we start. Treatment's going to be very dependent on what kind of heart disease we have. Do we need to go on oral medications or transdermal medications? Do we have to dig a little deeper, and maybe do I have to refer out to a cardiac specialist like a veterinary cardiologist? So that can happen at some point. So it does really depend on the cat and what disease we are diagnosing.
Why is early detection and diagnosis so important for a cat with heart problems?
So you don't get blindsided. You don't want to be having, a cat that, you've had it your, 10, 12 years, and maybe it's been to the vet twice, right? And then all of a sudden you're like, oh my God, something's really wrong with Fluffy. Fluffy is like breathing hard, better go to the vet. And now the cat hasn't seen a veterinarian in 7+ years, and we have full blown heart failure. Or we've thrown a blood clot, or, the cat's like actively trying to die. Well, what if we would have caught that a year ago? These yearly exams are so important. Preventative medicine is so important. Why do human women get mammograms? Okay. Why do men have to, make sure that certain parts of their body, when they're asked to cough, are okay? It's preventative medicine. And we have to remember that, yes, the visit can be stressful, but what's worse, losing your cat to a disease that we could have treated, or catching it early and prolonging your cat's quality of life and keeping your cat with you longer. So I hope this helped open your eyes to some things about cats and cardiology and heart disease. It's certainly just broad strokes. This is not super detailed. If you do have questions or concerns, or if your cat has been diagnosed with heart disease, please follow up with our office if you have questions, and we'll be more than happy to talk with you.